Hi, my name is Emily and I work for Rädda Barnen Sverige. Here are some tips for parents and caregivers on how to talk to their children about the coronavirus. Tip number 1. Discuss the coronavirus. Talk to children about their worries and questions. Children are affected by everything that is happening right now. They hear adult discussions and news reports on the coronavirus. Most importantly, children are affected by how adults are reacting to the situation. Preschools and schools may be introducing new routines to prevent the spread of the virus, and this can lead to children believing that something very grave is about to happen or is happening. All children are different. Some will barely notice the buzz around them, while others will interpret everything. They may potentially see new routines and adult discussions as signs of danger. So tip number 2, take the time to listen. Make sure you are present when talking to children about the coronavirus, away from distractions and interruptions. It's also advisable to have the discussion when you have enough time to answer all their questions. A tip would be to choose a time when you normally talk together, for example, at the dinner table or at bedtime. Choose a moment when you, the adult, are calm and able to be reassuring. Three, take your cues from the child and their questions. When talking to children about the coronavirus, it's important that you start with the child's questions. Try to focus on what the child is actually interested in finding about, rather than more detailed information that may be more appropriate for adults. Children of preschool age often need a lot of help from adults to translate their emotions and thoughts into words. It's important that adults notice if children react out of concern. They may react to a change in their regular routine or something similar. It's key to remember that younger children respond more to what adults do than what is said. Neither do they understand the news reports in the same manner than older children do. When talking to children of school age, it is safe to assume they already have quite a lot of information, since they understand some of the news reporting and are often active on social media. For this group of children, it's very important that you can start from what the children know about the coronavirus and about their thoughts, their assumptions, and their questions. Tip number 4 is stick to the facts. When discussing the coronavirus and addressing the children's questions, try to be as objective and state the facts as much as possible. It is also important to remember to adapt your language to the child's age. It is good to give children information about new routines and explain why such routines are important. For example, you can share that there are adults in Sweden who are working on giving advice on what we should do to reduce the risk of contamination as smartly as possible. Most people who become infected with the virus become mildly ill, but there are some people who become seriously ill, or in some rare cases, die. They belong to the so-called risk groups, and they are often the elderly or people who have existing illnesses. Here are the most important routines to remember. Do not visit people who are elderly and sick. Wash your hands frequently or use hand sanitizer. When coughing or sneezing, do so in a tissue and dispose of it immediately or in the fold of your elbow. Stay at home when you're feeling unwell and rest until you're fully healthy again. And tip number 5, be calm, stay positive, and spread hope. As an adult, it is important to keep calm. When adults exhibit signs of anxiety, this very often triggers the child's own anxiety. The effects for the child can be much stronger than actual knowledge of what is going on. It is naturally important that you as an adult continue to trust the information provided by certified bodies such as the Public Health Authority, who give regular updates on the progression of state of affairs.